Hi everyone, Dr. Chris Ho here. Have you ever looked at your hand, your face, and spotted a few little brown marks and thought, are these just age spots? Should I be worried? Well, you're not alone. Today, we're unpacking what age spots really are, what doctors mean, what most people think they are, and why it's easy to get confused. Let's start with the basics. When doctors talk about a classic age spot, we mean a solar lentigo. It sounds technical, but it just refers to a flat, brown patch that shows up after years of sun exposure building up over time. They usually appear in your 40s or 50s and beyond, but if you've had more sun exposure earlier in life, you might see them even younger. It's not about your age, it's about how long your skin has been exposed. When I talk to patients, I usually call them age pigment spots. They are flat brown marks caused by cumulative sun exposure over a lifetime. But that doesn't mean more age spots equals more sun damage. Some people are simply more prone to developing them, depending on things like skin type, genetics, and how their skin responds over time. You'll often see them on the face, hands, and shoulders, areas that catch the most sunlight across the years. They're harmless, but if one starts to change, thicken, itch, or crust, it's time to have it checked. Outside the clinic, age spot is a catch all term. People use it to describe freckles, moles, melasma, seborrheic keratosis, you name it. Some even use the word age spot to describe a sunspot, which in Australia has a much more serious meaning. Here, we clearly differentiate the two. Age spots are cosmetic, but sunspots, solar keratosis, can be precancerous and often need treatment. If you're unsure about the difference, I've got another video podcast that explains sunspots in more detail. Liver spots, not quite. You might also hear people refer to these as liver spots. That's an old-fashioned term from when people mistakenly believed they had something to do with liver problems or toxins. They don't. Please remember, liver spots have nothing to do with your liver, and it's best not to use that term anymore. If you notice brown patches or pigmented spots in areas that aren't usually exposed to the sun, like the inner thighs, groin, or underarms, these are not typical age pigment spots. If they are new or changing, please show them to your doctor for proper assessment. So, why do we call them age spots? It's a fair question. They tend to show up later in life, so people call them age spots. But they are really a sign of how long your skin has been exposed to the sun, not just how old you are. Can you get rid of them? If they bother you visually, yes. There are treatments like lasers, freezing, or lightening creams. But if they are stable and not changing, there's no medical need to remove them. When should you see your doctor? Here's the thing. Some early skin cancers, including melanoma, can look very similar to an age spot at first. Most age pigment spots are harmless, but it's not always easy to tell the difference without a trained eye. That's why regular skin checks matter. Doctors can spot subtle changes long before they become obvious, and the peace of mind is worth it. We use an instrument called the dermatoscope, which magnifies and can see in the thin layers of the skin. You don't need to monitor every spot yourself. Just make skin checks a part of your regular routine. Australia has some of the highest ultraviolet radiation levels in the world because of our location, ozone, and outdoor lifestyle. Sun damage builds up quickly here, and you don't need hours in the sun for it to happen. Just short, regular exposure can add up fast. That's why sun protection is so important. As I explained in another video podcast, sun protection is also the most powerful anti-aging step you can take. So that's the truth about age spots, what they really are and what they aren't, and why it's worth knowing the difference. If you found this helpful, give it a thumbs up, leave your questions below, and subscribe for more skin and other health tips. The sun is not the enemy. It's small doses. It's actually good for you. It helps with vitamin D and mental health. But too much sun, it becomes toxic and dangerous. Balance is everything. The right amount with the right protection. Thanks for watching. I'm Dr. Chris Ho from Brisbane, Australia. See you next time.